Well, more New South Wales residents are diagnosing and self-medicating themselves for ADHD than ever before. New data from the Daily Telegraph reveals Newcastle, Wyong and Penrith are being called the ADHD medication capitals. The three areas have recorded the highest number of prescriptions in the 5 years to December 2022. Wait times for patient diagnosis have now blown out by more than a year. Off the back of sky-high psychologist fees, it's resulted in some practices closing their books to new patients. The Royal Australian College of General Practitioners says GPs could be playing a much larger role in diagnosing and treating ADHD. Joining us live is Dr. Nicole Higgins, the president of the RACGP. I really appreciate your time. Thank you. Let's just start at the beginning here. Are we actually seeing an explosion of ADHD diagnoses, and why is that? Are more people suffering, or is it just that more people are being diagnosed? Could Australia be over-diagnosing this condition?
Well, I think people need to realise that this is the commonest mental health presentation in our children. 1 in 20 Australians have ADHD. And it's not in isolation. It's often with other conditions such as anxiety, depression, autism spectrum disorder. It's something that presents to GPs very commonly, and increasingly we are becoming more and more aware of the struggles that people have with ADHD.
Okay, so when people present with these problems to their GP, what happens then? Who can actually prescribe and then diagnose ADHD medication? Does it need to be sent off to a specialist?
Yes, so it's actually quite complicated, and it's a really difficult journey for people to make. And it's a diagnosis that's made in different places and different settings, and it's in consultation with people's family, the school. It could be using a psychologist, an occupational therapist. There are multiple people involved, and depending where you live, access is really hard. I live in regional Australia, and people really struggle to access diagnosis and management, and yet see their GP regularly. As I said, it's one of the commonest things that we actually deal with.
There is a push for ADHD sufferers to be included in the NDIS. Where do you stand on that?
So the NDIS, as I said, often what happens with ADHD, it's in there are other conditions it's often with, such as autism spectrum disorder. So that's already included within the NDIS. What we really need to do is make sure that we improve our access for diagnosis and management for people, and ensure that that's easily accessible and also affordable.
And so in terms of the complicated nature of actually diagnosing ADHD, what are you proposing in terms of what GPs should be able to do? Are GPs qualified to diagnose ADHD?
Well, it depends which state you're in as well. What you can do, if you can diagnose or prescribe, if it's a child or an adult. So we'd like to have some national consistency around that. And we'd also like to open up to make sure that, your GP is part of that team that coordinates with school teachers. It might be an occupational therapist or a psychologist, so that we can actually use the tools that are already there for diagnosis and make sure that we can streamline things for people. At the moment, it's really difficult.
I mentioned in the introduction that people are self-medicating for ADHD. I assume that's not the best idea?
No, so people are going online, they're self-diagnosing. There's a lot on social media and TikTok about ADHD at the moment. They're trying to see if other people's medications work for them, so it's a bit of a trial of treatment. We also know that if there's a family history, that makes it much more likely. So people are really struggling and often having to do it themselves to get to that diagnosis.
Dr. Nicole Higgins, appreciate you making the time. Thank you.
Thank you.